With Gannett Media in Oklahoma City, I'm Dave Morris. Today, a conversation about COVID-19 and the upcoming flu season. We'll go over some questions as, can you get COVID-19 and the flu at the same time? Are flu shots a good idea this upcoming season? And even wearing a mask now potentially help against the flu? Solid questions, and we'll get some answers today with our friends and experts from Integris Health. Joining us today, Dr. Jeffrey Cruzan, President of Integris Medical Group. We also have Dr. David Chanson, Medical Director of Infection Prevention, and Dr. Bradley Burgett, who specializes in internal medicine and pediatrics, again, all with Integris Health. Doctors, I know you're busy people. Thank you so much for your time today. We appreciate it.
Thanks for having us.
Dr. Cruzan, I'll lead off with you. What are some of your concerns about the approaching flu season?
Well, my biggest concern is we're going to have a flu season that coincides with the current pandemic, with the SARS-CoV-2 virus, COVID-19 illness, and it's going to be hard to tell the two apart. And then the second thing is it's very difficult to get adequate testing done at this time, which would help us tell which one we're actually dealing with. So that's really my two biggest concerns, is trying to ascertain which one it is, and then just being able to make that determination based on testing, which we're struggling with right now.
Dr. Chanson, if you can piggyback off of that, excuse me, what are some of the conversations among the medical community about those concerns?
Now, Jeff and I have been talking about this for quite some time, and I'm sure Brad has run into this problem as well. It's really very difficult to tell the difference between COVID and influenza just based on a patient interview. I mean, it's the same symptoms, right? Shortness of breath, cough, fever, myalgias, things like that, diarrhea, what have you. And so it can be, the x-ray will look the same, the labs will look pretty similar. And so what we need is faster testing. We continue to drill down on opportunities for that. It presents its own challenges. Influenza, for example, this year when we started with COVID, we were testing people for influenza also at the very beginning in February when we first started, looking for it in March. And what we were finding was that the flu swab that you normally might get at your primary care doctor's office, called an influenza antigen test, was not picking up certain kinds of flu. And so we had to go to a further test called a PCR to try and find flu. And we found a circulating strain that had not been very easy to find before that. Those tests take time. The tests that you get in your doctor's office, the flu test that you get that takes 10 minutes, there are COVID tests like that also, but they're not as accurate as what we call the PCR test, which is kind of the main test that we're using. So to try and find those testings on platforms where you can get the quick answer from your physician at an outpatient visit, or from your healthcare provider at an outpatient visit, and that we can get accurate information to treat it appropriately. The medicines for flu and COVID are different. There are things that we do in COVID that we don't do in flu, and vice versa. So getting that accurate information continues to be a challenge. And Dr. Cruzan and I have talked a lot about exploring different testing platforms to make sure that we bring as much possible to the bedside so that patients can get the quick information and sort of know what appropriate precautions to take.
Oh boy, it seems like nothing in 2020 is easy, right, guys?
No, it isn't.
No.
It isn't.
Dr. Burgett, I'll come your way. As we mentioned, you specialize in internal medicine and pediatrics. Mm-hmm. If it's confusing among medical experts about coronavirus and flu, what should parents be concerned with, and what should they be looking for?
Well, I mean, that's a big question. As both of them mentioned, it's a challenge to get adequate testing, adequate diagnosis. As we're looking forward to the school year, this is going to really impact our kids when they go to school and miss time in school. And so, parents are going to be looking for answers as well as for themselves on, gosh, what do we do? How do we test? What do we do when we're out of school? What do we do when we're out of work? Am I now out of work because my kid is potentially waiting a test to come back? So there's a ton of things that we're going to be anticipating parents to look for this upcoming flu and COVID season. And as Dr. Chanson mentioned, we're needing greater access to these tests, quicker turnaround times of these tests, because we have a lot of overlap in these symptoms. Kids, interestingly enough, with COVID, don't seem to be responding the way adults do, whereas dramatically, there's still some question on, how much they contribute to this pandemic. Certainly, we know that kids can get infected. Certainly, we know that they can transmit the virus, but to what degree, we don't know. You look at the numbers, even in Oklahoma, it's considerably less under the age of 20, and even considerably less under the age of 15. We only make up a small fraction. I think I looked at some numbers in the literature as 6% was kind of what was roughly quoted nationally a few months ago. So the symptoms are very similar to, as Dr. Chansall mentioned, upper respiratory tract type infections, sneeze, cough, fever, headache, feeling kind of achy. These are very common things. Typically, we don't see GI symptoms with the flu. The stomach flu is somewhat of a misnomer, but we have seen cases of COVID causing GI upset or diarrhea, nausea, vomiting in and of itself without some of the respiratory things. So as a pediatrician, it's become very challenging to figure out, gosh, who do I screen? Who do I test? And in some ways, it's kind of, well, if you have any current problems because of how prevalent COVID is in general, we end up testing those folks. So, parents are having to look towards the pediatricians for guidance on that. We're having to look for potential options for daycare, potential options for what parents are going to do when kids most assuredly at some point are going to have to be home from school, because you think about just a few times a year you get a cold, and even a cold could be that very thing. So it's a very broad thing that you have to look at, and certainly some concerns for parents as well as their kids and for themselves.
Well, perhaps among those concerns, maybe parents or just any of us might be a little bit less apt to go to the doctor when they have the cold or the flu. Any thoughts on that, of people perhaps avoiding going to the doctor or seeking medical help, just in light of all the things going around? And Dr. Cruzan, I'll throw that your way. Any steps being taken with Integris Help to help people get over those fears?
Well, thanks for asking that, because we've really gone, I think, above and beyond to meet the CDC guidelines to make it as safe as possible to come into the clinic. Of course, if we can do something on a virtual visit, we really would prefer to do that. Just simply, we can keep you safe and keep our staff safe. But if we do need to bring you into the clinic, you do need to be seen. We have a very elaborate check-in process where we screen you before you come into the actual clinic setting. You'll bypass the waiting room completely. The staff will check you in at the front door. They'll walk you straight back to an exam room. You'll get your vital signs taken and get checked in there. And then you're wearing a mask. We're wearing mask and some type of eye protection, either a face shield or eye goggles. And then once we're done seeing you and you're escorted back out, that room is completely disinfected at that time and not used for several minutes, so that we can air out that room. So we really are going to great lengths to keep you safe and to keep our caregivers safe as well.
Dr. Chansall, let me come your way. Medical Director of Infection Prevention with Integris Health. One of the things that was mentioned earlier was the strain of the flu. What about flu shots this year? Is it too early to know what sort of strain, and I speak of complete ignorance here, too early to know what sort of flu strain we might be dealing with as we get into flu season? And are flu shots still considered a good idea?
They've always been a good idea, and they are going to be very important this year, because you definitely don't want to get piled on. The way the flu shots are made is they take predominant strains from the Southern Hemisphere and then make the vaccine from those strains. And some are 3 strains, some are 4 strains, some have higher doses of vaccine in them than others. And that's something you can talk to your doctor about. But the bottom line is the flu vaccination recommendations have not changed a bit. Some years the flu matches more closely the circulating strains than other years. Again, you know, that the utility, even if you get the flu, you're clearly much less likely to have a more severe case of the flu with the vaccine. And that's really important. That was really good data that came a couple of years ago from the pediatrics literature that showed that the mortality was decreased with influenza, even though people might get the flu. They're not near as sick. Now, when you pile that on top of COVID, we want everything we can do to keep our lungs as healthy as possible. And for some people, that means a lot more than others. Certainly, Dr. Burgett and Dr. Cruzan are going to be talking to their asthmatic patients, how important it is for them to be getting those regular assessments. Patients who are smokers, patients who have chronic lung disease, heart disease, diabetes, whatever. You know, but the flu vaccination recommendations aren't going to change at all as far as anything I've seen from any national bodies of information. I would kind of tack on to what Dr. Cruzan said about people coming to the clinic. I tell you, I practice a lot in the hospital. I'm a clinic doctor, but I also see lots of hospital patients. And one of the most concerning things, yes, the hospital is busy with COVID, but I am just as busy with patients who neglected some of their care for 3 or 4 months because they were afraid to go to the doctor's office and afraid to get out in public. And I can't tell you how many people we have in the hospital now whose COPD is worsened, or have had a CHF, congestive heart failure exacerbation, or have maybe let that foot sore go a little bit too long, and now it's developed a deeper foot infection. So it is just so important. Believe me, at Integris Health, we have drilled down. Dr. Cruzan and his group have done an extraordinary job drilling down on making the clinic experience as safe as possible. And if nothing else, they can do just what we're doing right now. They can Zoom and telehealth, get good information. And your doctor, we're getting better at this. We're getting better at this technology. Well, most of us are, Jeff, but we're getting better at this technology stuff. And we can kind of tell who we need to get back into the office. You know, I've had a few patients that I've done telehealth with, and I said, you need to come in. We need to get a little bit closer look at all of this kind of stuff. So, and as we continue to get into flu season, we can continue to learn more about COVID. I can only imagine that those processes are going to sharpen, and we're going to keep our patients as safe as we possibly can.
All right. So Dr. Berg, I had a question for you. Perhaps the nasal vaccine, nasal spray versus traditional shot. If the kiddo just, hey, I don't want to do the flu shot, still as effective?
Well, in more recent years, we've actually recommended against doing the live attenuated up-the-nose virus vaccine. And so more recently, and Dr. Chansholm might even be able to speak to some of this as well, we've preferred the injectable vaccine. And so, you know, we take great lengths to encourage parents of the safety of these vaccines, as well as their efficacy or how good they are. And some years, are better than others. Some years we really hit it out of the ballpark with the flu vaccine. Other years aren't as good as we would like. But as Dr. Chansholm was mentioning, you know, any degree of protection that we can provide, we want to do it. Because it means that you're less likely to get the flu. If you're less likely to get the flu, you're less likely to have what's called a flu-like illness. And so that also is something that we kind of consider. And one of the things that we have concerns over in this coming season is that, gosh, everything that sniffles and coughs isn't necessarily COVID-19, but we're in this place now where we have to assume that concern. And so if we can mitigate flu to any degree, if we can decrease the chances of somebody getting that, that's also decreasing time away from work, time away from school, worry. These are huge things that we want to encourage. And I'm hopeful that, you know, maybe this season we'll have a few more people that would get it that might otherwise not have gotten it in previous years.
Is there an age limit restriction, you know, too young to get a vaccine? And if so, what would you tell those parents?
Yeah, so typically it's 6 months and above that we start doing the flu vaccine. And the injectable version, actually in that first season, we recommend two shots, separated typically by about a month to fully immunize the child. And there are a couple other small nuances to that recommendation, depending upon how old the child is and what they have or have not had in previous years. There are a few other recommendations with the nasal vaccine as well. But for those infants are some might consider them at greater risk for having flu complications than COVID complications. And so that's why we really put forward that emphasis on having the family do kind of a localized what's called herd immunity. So meaning if everybody else in the family unit gets vaccinated, that they potentially won't get it. And if they don't get it, then they won't give it to their infant. Because I was just reading some literature. It looked like half of the kids that have had major problems from the flu in the past were previously healthy kids. And that's one interesting difference between COVID and flu, is that COVID tends to affect those folks that are a little bit older. Flu tends to affect those that are really young and also those that are really old. And so we certainly want to take that under consideration with those younger kids. Myself, I have a 3-month-old at home. And so we're going to do everything we can to protect our 3-month-old. And that may mean each one of us gets vaccinated to help minimize that risk within our own home.
All right. So the other side of the fence, Dr. Chansom, will come to you. What about the vulnerable population, or folks allergic to a vaccine or have other respiratory diseases, or just in that vulnerable in the COVID category case? What sort of guidelines for that population when it comes to flu this season?
Well, I think I'll be curious to see what kind of impact community masking has on influenza. Community masking isn't something that just came up with the COVID epidemic. Certainly, in other countries, masking has been a very popular endeavor for respiratory illnesses of any ilk. We've seen that with the H1N1 pandemic, 10 or 11 years ago. That masking was an effective intervention. So I think that's very effective intervention. When we talk about vaccine intolerance, those are continuing to be sort of tweaked for what kind of things really mean you have a true allergy. Even, flu vaccine is made with eggs, and even some of the components in flu vaccine nowadays, they can really even help people who have egg allergies and things like that. So talk to your doctor about whether or not they think you're a good candidate. But always, I encourage people to err on the side of getting the vaccine. If there's any question, man, I don't like getting a shot any more than anybody else, but getting the vaccine is just so important. And we have seen, people that get both tend to have a harder time. We don't see a lot. There had been like I said, back in February and March, when we were first seeing the COVID patients, we did have a handful of patients who were dually infected, and they had a little bit more trouble. They had a lot more trouble. And so trying to kind of, right now we do have a flu vaccine. I hope we'll have a COVID vaccine. We don't have one yet. So doing everything we can to try and stack the deck in our favor just ever so slightly might make a big difference, and mean the difference, quite frankly, between life and death.
All right, I know we need to wrap this up. I'll get you guys out of here on this question that you've all kind of alluded to earlier, and perhaps we just don't know yet. But in closing, could the current prevention guidelines against COVID help against the flu, and would it be possible to get the flu and COVID-19 at the same time? I know we kind of touched on it. Perhaps we don't know. Dr. Chansom, I'll stay with you first.
Yeah, I think the social distancing, hand hygiene, and community masking. Where social distancing and hand hygiene first came from? The 1918 flu epidemic. There had signs back then that said, keep your distance and wash your hands. So yes, it can protect against the flu. And the masking we've already talked about. And then, we don't want people getting both. We don't want people getting either, but getting both can certainly be, it can be difficult. It can be very, very challenging for us to treat, and it can, predictably, you're kind of piling on your lungs quite a bit there. So,
Dr. Briga, your thoughts?
Yeah, I'm really hopeful that some of the protective measures that we're taking will indeed reduce some of the flu cases. It's interesting. My wife calls me a germaphobe. I like to think that I'm more germ aware. And so many times, when I'm out in public, I see a doorknob, I'm like, I'm not touching that. Or the first floor button on an elevator, right? Everybody touches that one. So for me, they're like lights that go off. And that's been the way it's been for me, just knowing how infectious disease works to an extent. I think probably Dr. Chansom has some of those same kind of idiosyncrasies. I don't want to put too much in his own mouth there, but I figured that some of those things now are more aware because we've done broader discussions on, hey, this is how infection is generally spread. This is how we think that respiratory viruses are generally spread. We still have a lot to learn about COVID. We're still debating on whether or not it's truly droplet only or a little bit of aerosol, meaning can it hang in the air a little bit. We think that it's primarily just droplet being within close proximity to people, much in the same way that flu is spread. So a lot of the prevention measures, wearing masks, washing hands frequently, avoiding touching your face as much as possible. These are things that will hopefully decrease both flu and COVID moving into a sixth season that could be very interesting, that's for sure.
And Dr. Cruzan, the final word goes to you.
Okay, great. Thank you. So, yes, certainly you can have both illnesses at once, and it makes it very horrific for the person who has that, particularly if they're immunocompromised, have other comorbidities, things like kidney disease, diabetes, heart failure, things of that nature. And then as far as things that we can do, as both other physicians mentioned, you know, I can't stress enough that we really need to be wearing masks when we go out into public. You know, the city, county health department, state health department has put together some information on this. Don't go to bars, don't go to the gym, avoid gatherings where there's a large number of people, weddings, funerals, church services, get-togethers at your own home, and other types of get-togethers in other places. Going inside is a problem. If you're inside someplace other than your own home and not having a party, you need to have a mask on. It's imperative. And one of our colleagues who says it's irresponsible for us not to do that, and I have to agree. You know, as Oklahomans, you know, we all come to each other's aid. You look at what happened during the bombing. Whenever we have a tornado, we all come in and help each other. It's Oklahoma standard. So in my mind, the biggest thing we can do from an Oklahoma standards perspective is to wear a mask. And then, as the others mentioned, wash your hands. And then I'm not so much about socially distancing. I think we need to maintain contact with each other, but physically distancing from each other is the important thing. We need to stay, you know, an appreciable amount of distance away, at least 6 feet when we go into stores. Try not to bump up against each other in lines, and certainly avoid those other places that I mentioned. You have to wear a mask if you're going to be in any of those scenarios, and it's best to avoid them at all costs. And as Dr. Chansom has said before, don't touch your face. That's the port where these organisms get into our body. So, you know, wash your hands, don't touch your face, appropriately distance yourself, and wear a mask.
COVID-19 and the upcoming flu season. 2020, it's the year of survival, I think. A good conversation here with our friends from Integris Health, Dr. Jeffrey Cruzan, Dr. David Chansom, and Dr. Bradley Burgett. Gentlemen, again, thank you for your time and expertise. Thank you very much.
Thank you.
Thank you.
Thank you.